Good morning again, friend. Today on day 6 of 77 of Biking to Work Challenge. I invite you to join me for 7-8 minutes, which is what it takes me to get to work, and have a discussion on the benefits of exercise and taking note of people biking like that gentleman and other people walking perhaps on this beautiful day, in an effort to motivate each other to engage in sustainable, meaningful bouts of physical activity when we can. And today I wanted to come back and expand a little bit on a statement I made a few days ago on the benefits of physical activity in terms of mental health. You know, anxiety and depression are very common. I see patients every day that come to seek help for this. And I mentioned a couple of videos ago that there are studies showing that regular physical activity can be as powerful as the average dose of antidepressants and anti-anxiety medications for these conditions. But there's a study in 2022 that it's actually a meta-analysis, a study of studies that looked at over 100,000 people. And what they found is that when it comes to the potency of exercise, of physical activity, if somebody does the minimum recommended, which is 150 minutes per week moderate intensity activity, or at least 75 minutes of vigorous activity per week, they can expect to experience an improvement in symptoms of mild to moderate depression and anxiety of 1.5 times that of antidepressants. So exercise is more potent, according to these guys, by 1.5 times than the average dose of an antidepressant, anti-anxiety medication, things like Prozac, Zoloft, Celexa, and so forth. Now, I think even more interesting, or equally interesting, is another study that was just published the other day. It's around, today is April 16. I saw it published yesterday, actually. And this was published in a cardiology journal. And the researchers here had a very interesting idea. They wanted to look at the effects of exercise, various degrees of exercise, starting from no exercise to meeting the guidelines I just mentioned, and to even going beyond that, looking at all people along the whole spectrum of exercise. And they divided them in 5 groups, depending on the intensity of exercise, 5 quintiles, as they call them in research. And then they follow them for 10 years, 50,000 people. So large study, 10 years follow-up. And they looked at markers of stress, okay? Markers of stress. And interestingly, they measured these markers of stress with a special form of MRI that looked, functional MRI, that looked at different parts of the brain and the activity exhibited there. You know, they looked at the amygdala, where a lot of the stress signals originate, and they looked at the prefrontal cortex, where the executive function, you know, decision-making, planning, memory, and most importantly, behavior control, impulse control, happen. And they developed a measure of basically mental stress by evaluating the ratio of activity between these 2 regions of the brain. And then at the end of 10 years, or throughout the decade that they followed these 50,000 people, what they did, they looked at how often were these people getting cardiovascular disease, and then they looked at those 5 quintiles, 5 levels of activity and whether there was a difference in the incidence of cardiovascular disease, things like heart attacks, strokes, and also importantly, whether those numbers were correlated in any way with the measure of stress, and whether the measure of stress was different, of course, along those 5 groups. So it was a complex study in a way, but simple at the same time. So here's the breakdown of what they found. They found that there was a graded decrease of stress, mental stress, along the 5 quintiles of physical activity. In other words, people who exercised the least had the most amount of stress signals, and those who exercised the most, over 300 minutes per week, had the least. So you could say that there is an association, a very strong, statistically significant association between regular physical activity and stress, mental stress signals. The more exercise, the less mental stress. Now, association is not always causative, but I have good reason to believe that in this case it is. The second thing that they noticed, and even more exciting in a way, was the fact that the same but inverse association was found between the risk of cardiovascular disease, of heart attacks, strokes, and the levels of physical activity. And that is, the more physical activity somebody did, the less risk of developing one of these undesirable cardiovascular events they faced. And here there was something very interesting. People without a history of depression plateaued in terms of this benefit after experiencing about a 20 to 30% reduction in cardiovascular disease risk once they reached the guidelines, you know, the 150 minutes or so of exercise per week. There's another pedestrian, but he's walking to his truck. We are not going to count him, or to his car. However, in people with a history of depression, their benefit continued up to, in people with more severe depression, a decrease in risk by about 50%. 50% risk reduction with a lot of exercise in people with a lot of with a history of depression. So I mean, this is massive, guys. This is absolutely massive. But here we are. I made it to work today. You guys think about these things and stay active. Talk to your doctor. Make sure it's safe to exercise. I'll see you again tomorrow.